Hey, Mike. Last time we talked about healthcare when you're on active duty or a drilling reservist. This time we're going to talk about your healthcare options for retirees or when you're done being an active reservist. It's confusing, so let's try to get into the details and make it less confusing for our retirees.
Yeah, there are definitely, a lot of choices to be made, especially, coming out of the military where it's like, okay, TRICARE Prime and most often seen in a military treatment facility. Now you've got this, I'd say more smorgasbord of options. And so what's right for you? So I'm looking forward to diving into that.
Welcome to Operation Retirement Readiness, where Amy and Mike, two certified financial planners, talk about how military members can prepare for transition and how veterans can prepare for ultimate retirement. This podcast represents the views of the hosts and any guest. It is for informational purposes only and should not be considered tax, financial, or legal advice. All information is regarded to be from reliable sources. The hosts are not responsible for any losses, damages, or liabilities that may arise from the use of this podcast. This podcast is not intended to replace professional advice.
Okay, so again, last show we covered TRICARE options while you're still serving. So by way of review, let's just do a quick overview of what we already talked about, and then we'll jump into TRICARE after retirement, which is things like regular TRICARE after retirement, TRICARE Reserve Retiree, TRICARE for life, and then we'll throw VA care in here as well. But first, Mike, how about a quick overview of our last show?
Sure. Two primary options when you're on active duty for military members, as I said, always going to be TRICARE Prime. Um, Family has options while you're serving, and families can choose between TRICARE Prime or TRICARE Select. And TRICARE Prime, a health maintenance organization, HMO like, where you have a PCM and they coordinate your care. TRICARE Select is the preferred provider option where you have a network. You can go to those, but typically you're going to pay more on the TRICARE Select side than you would with the TRICARE Prime.
Exactly. We also covered TRICARE Reserve Select for reservists. And we also covered costs of all of these plans in the last show. In the interest of time, I'll just point you to the last show and or the TRICARE website to go over the 2025 costs for those plans. But for now, let's go ahead and jump into how things change when you retire.
Sure. So as it turns out, it's relatively similar. The military member has increased options now. Instead of just being tied to TRICARE Prime, you can now also choose TRICARE Select for you and your family. So um, costs are slightly different, but overall, as Amy said, if you want a full treatment of the difference between Prime and Select, go back and listen to our previous episode where we walk through that. But again, the biggest difference now is how much you're going to pay as being retired.
Exactly. So there's like an annual enrollment fee. They still call it an annual enrollment fee, but you're going to pay monthly. Um, Still inexpensive. Members, so when you retire, you've got 30 days to enroll in either TRICARE Prime or TRICARE Reserve Select. Again, not to get too far into the details, as far as TRICARE Prime, there are different flavors of TRICARE Prime. So it's just like in our last show where we talked about there's TRICARE Prime, and then there's US Family Health Plan. So that's basically the TRICARE option where there's a private contractor administering the plan. For example, PacMed out west or Hopkins here in the Mid-Atlantic area.
Yeah, and again, we talked a little bit about, and we'll get in more into is reserve retirees. They're in that gray zone. Do have lose access to TRICARE Reserve Select when they retire, but they do have access to TRICARE Reserve Retiree again before they turn 60, and that is an option. So, Amy, you want to kick us off with talking about that?
Yeah. So when a reservist retires, so you're leaving, you're not drilling anymore, you're no longer eligible for TRICARE Reserve Select, which is actually a pretty affordable option. Instead, and also you're not yet eligible for TRICARE. So as a reservist, you will be eligible for TRICARE, but not until you're age 60. So no matter when your pension begins, you're still not eligible for TRICARE, regular TRICARE for, that's just like an active duty retiree until age 60. So in between, in that gap, in that gray zone area, there is the option of TRICARE Reserve Retiree. We've talked about it already. It's a little bit more expensive. Um, it's more like TRICARE Young Adult. We went through that before. Mike, not to dwell on costs and things like that, but do you want to give us an example of about how much it costs for TRICARE Reserve Retiree?
Yeah. So for reserve retiree, just to cover the member, it's $631 per month. If you're doing the family, it's over $1,500 per month. And then you're still going to have deductibles and out of pocket or out of network costs. And we talked about catastrophic caps last time, and that's also significantly higher. It's about $4,500 per year for your catastrophic cap. So again, significantly more expensive than what you're going to pay for, you know, than you were under TRICARE Reserve Select while you were serving. But it is still an option if you don't have other good options for healthcare through an employer or somebody else that is there to cover you.
Yeah. And again, it's to cover the gap, because when you turn 60, you're then eligible for sort of regular TRICARE. So TRICARE, just like active duty folks. But let's go ahead and switch gears and start talking about TRICARE for Life, which I'm not sure people understand really what that is. So TRICARE for Life, is what happens when you turn 65, and it is by individual, so not by service member age or spouse age. It is by individual. So when the TRICARE beneficiary reaches Medicare age, which is age 65, they are required to enroll in Parts A and Part B of Medicare. Medicare Part A is usually free. It's been paid for through payroll contributions through the years. Medicare Part B has a monthly premium, and it depends on your income, so your modified adjusted gross income. Right now, the lowest cost premium is about $185 per month. The highest premium can be, upwards of, $400 or $500 per month per person. Again, these are per month per person numbers. We didn't give you the number for the annual enrollment fee for, say, TRICARE Prime. So if you're retired and you're on TRICARE Prime, your annual enrollment fee is roughly $60 a month. So when you go to TRICARE for Life, you're going to jump from $60 a month for both you and your spouse or your whole family to $185 per month per person. So it is more expensive. You don't pay the TRICARE fee though. So that's good news. Small favors there, right, Mike?
Yeah,
Um,
yeah,
you want to fill us in on a little bit more about how TRICARE works with Medicare?
sure. The other piece, there is a drug piece of Medicare called Part D that most people usually subscribe to get parts of their medical or their prescriptions covered. And when you are on TRICARE for Life, you're covered. You don't have to pay that additional piece. So that's some other savings that you're going to have, which is good news. Um, and it basically, once you get on Medicare, TRICARE kind of becomes the second payer, and they cover a lot of those additional costs. Some of the copay stuff and things that would be present under Medicare will now just go to TRICARE. So that's really how they work together. It's kind of the backup, and when you look at the charts, most of your costs are going to be covered you're not going to have a lot of out of pocket other than that Part B fee that everybody pays based on income. Anything
Exactly.
to add on that, Amy?
No, I mean, I agree. Out of pocket costs go way down, so it's more expensive per month for a premium, but it's more predictable because your out of pocket cost and the catastrophic cap is still in place. So even if you were to encounter a situation where, Medicare didn't cover a lot, TRICARE didn't pick up much of it, um, you know, and the one example that I think of most often is, Medicare and TRICARE will pay for hearing aids, but they're not going to pay for the best hearing aids. So if you want a higher quality hearing aid, you're going to pay out of pocket for something like that. Let's change gears. Mike, I know that you use the VA for your healthcare. Let's talk about how VA healthcare works for folks.
Sure. So VA, everybody is eligible for VA, if they've served more than 24 months. The question is, are you going to have to additionally pay for that? So VA's got, I think it's up to 9 different groups that you need to go through and look at. But basically, if you've got more than a 50% VA disability rating, you're in group 1 and can get seen at the VA. And like you said, I came out of retirement, the VA was very good about calling me all the time and like, hey, let's get you going, let's get you in. So I went, I got a great doctor that I really like. And so I was like, oh, I guess I'm just going to do this for right now. So while I'm still covered by TRICARE, because my family is, I have not, even gone to see my PCM at this point on the TRICARE side. But again, VA, you hear people complain about it, and if you're not near a VA treatment facility, like you said, you aren't, Amy, it's not convenient. That can be probably the downside of VA, but mine's not that far away. So I do that. And I was telling you earlier that, they said, hey, I think you ought to go see a dermatologist. So I left the appointment and I wasn't even home yet. They were calling me on the phone trying to set up my appointment for the VA or for the dermatologist. And I got seen within the next week. Whereas my daughter had a similar thing where her PCM was referring her to a dermatologist locally, and it was 2 months till she could get in to see the dermatologist. So you hear a lot of people, bashing the VA, and there definitely have been problems, and not trying to make light of that, but I definitely have, had phenomenal care with the VA. They want to see me every 6 months, which was unheard of in the military. Maybe once a year, or a lot of times it's stretched to once every 15 months type of thing. But again, I can't say enough for my treatment at the VA. So um, anything we missed on that?
Yeah, I'll just add, I mean, that, if you're a Guard or Reserve veteran, it is a little bit different. So the 24 months is if you're an active duty veteran. For Guard or Reserve, you had to have been called to active duty under a federal order at some point, and you had to have completed that entire period of duty that you were called for. At this point, there are lots and lots of people who meet that requirement. So it just depends on, when you served and things like that. I'll also just add that, Mike alluded to the fact that there's different priority groups. If you are in one of the lower priority groups, like 7 or 8, then you can have copays. Other groups might not all of them, not priority groups 1 or 2. I can't remember where they are, but just depending on the group might depend on some out of pocket costs. But I've heard many stories, just like Mike has pointed out, that the VA is doing a great job taking care of veterans. Maybe not 100% across the board, because we do hear the not great stories, but I've definitely heard more good than bad. Okay,
Maybe I'll
so
add I'll add one
yeah,
more thing on that. Along with the copay, some of that is tied to income. So they will, depending on which group, you'll have copays, and some of those are based on how much income you have. So if you're a retiree working a second job and are in one of those lower groups, again, TRICARE, maybe and probably is a better option type thing. But again, you do have those options, so I definitely encourage you to check out both and just see which works, better for you.
Yeah. Um, so like we wrapped up last time talking about key considerations and in your decision, let's talk about how to make your choices as you head into retirement, either as a reservist or active duty service member.
Yeah, they're similar. Access to care is probably, should between that and money should be the biggest things. But looking at where you live, retirees can still get seen at some military treatment facilities. So if you're very close to base, you're retired, out of a large facility that still does that, you may be able to keep going to the MTF for care. Like you said, Amy, VA isn't convenient for you, so the TRICARE plan works best. So again, really evaluating your access to care, what you need, how often you need it is probably one of the big considerations.
Yeah. And there's an extra layer of consideration, and it doesn't really have to do so much with your healthcare choice because TRICARE for Life is not a choice. Um, it has to do with, looking ahead and doing some tax planning to help yourself. So like we mentioned before, those Part B premiums are tied to your income. And we've talked about this in other episodes where, when you're a military retiree, you've got the pension. Sometimes it's a substantial pension. You may or may not have another pension if depending on the employer that you work for. If you've done a lot of pre-tax savings, then when you get into your 70s, you're going to end up with those required minimum distributions. So that's an additional income plus Social Security. So a lot of times service members can end up in the highest tax brackets they've ever been in their 70s, which means that your medical costs are going to go higher. So when you're thinking about, preparing for retirement, this is where tax planning becomes so critical, and it's linked to not just, wanting to pay less in taxes over your lifetime. It can also impact the amount of money that you're going to pay for healthcare over your lifetime. Mike, did I miss anything there?
No, I think that was definitely a good point to hit on that. So, um, but yeah, that's I think we covered pretty much everything on the retiree side. Again, a lot more choices as you retire from as the military member. You've now got more of a smorgasbord to pick from. So, really understanding that. I didn't really again look into it much until I retired, and really trying to figure out what really is best. So encourage you to do it, even before, as you approach retirement versus wait until that 30 days when you got to make that selection type thing. So I just, take your time and understand this. It's important.
Yeah, for sure. And and there's people out there, we've retired, your peers have retired. Talk to them about their experiences, not what they think they know, but what they actually experienced. Because I'll be honest, I didn't find the choice all that difficult. In terms of what plan I wanted. But I did have a situation where I needed medical care and I had no idea how civilian healthcare worked on the outside. So, when you're in the military, you just go to the MTF and they just tell you where to go. But it works a little bit differently on the outside, even if you're TRICARE Prime. So use your peers. Let us know if you have questions. Other than that, we'll see you next time.
All right. Thanks, Amy.
Thanks, Mike.
To get transcripts, show notes, or more information, go to operationretirementreadiness.com. Have a question or topic for the podcast? Send it to info@operationretirementreadiness.com. Find out more about Amy and Mike at their websites. Mike is the founder of Next Mission Financial Planning, LLC. He retired from the U.S. Air Force and has worked in the financial services sector since 2021. He is a certified financial planner, chartered financial consultant, and a certified college financial consultant. You can find out more about Mike at nextmissionfinancialplanning.com. Amy is the founder of Instar Financial Planning, LLC. She is retired from the U.S. Army and has worked in the financial services sector since 2019. She's a certified financial planner, a chartered federal employee benefits counselor, and a chartered retirement planning counselor. You can find out more about Amy at instarfp.com.